My name is Maggie Lutz, and this is my persuasive speech presentation. I'm sorry if you hear background noise. My grandma just had surgery and she's watching TV downstairs, and it helps her rest while she's recovering. According to the National Survey on Drug Use and Health, nearly 10 million Americans misused opioids in 2019. That's 1 in every 20 adult Americans misusing opioids. I'm sure that it won't be my speech or a compelling statistic that will convince you of the issue of opioid misuse and addiction in our country. This problem permeates almost everybody's life to a certain degree, whether it be through a personal encounter or through pop culture and media. With that being said, do you feel equipped to handle encountering a friend or a family member struggling with addiction? What would you do if you were in an overdose scenario? I would like to utilize this time to share my knowledge and experience throughout my nursing education that may be useful in equipping you to encounter and care for those struggling with opioid addiction. Opioid addiction is not a new phenomenon and also does not seem to be going anywhere. Therefore, as God calls his people to care for the vulnerable and the sick, by being equipped in knowledge and comforting to those struggling with addiction, you can do just that. In order to equip you to handle individuals struggling with addiction or in danger of an overdose, I will discuss what opioid addiction is, compassionate and caring therapeutic communication for those struggling with addiction, and resources to handle an overdose scenario. Let's get started. Opioid addiction is the behavioral manifestation of structural changes within the brain that occur due to predisposing risk factors to addiction and prolonged opioid misuse. Opioids, like many other substances, act on the mesolimbic reward system in the brain. This is a collection of several areas within the brain that impact a person's decision-making and everyday life. When a substance is introduced, the mesolimbic system is altered and hormones that produce feelings of happiness, relaxation, and pain relief are released in response to an opioid. This is a picture of the mesolimbic reward system and the different areas of the brain that it affects. This is the prefrontal cortex that impacts decision-making, the amygdala and the midbrain, which impacts behavior, and then the locus coeruleus and the brainstem, which impacts vital things to survival, such as heart rate and breathing. All of these things become impacted with opioid use, and the most severe effects would be on the brainstem, and heart rate and respirations can be altered, ultimately leading to death in the case of an overdose. In a normal brain, activities such as spending time with loved ones, eating good foods, and engaging in fun activities act on the same mesolimbic reward pathway, but once an opioid is introduced, the whole pathway becomes altered and revolves around that opioid, and only that substance can reach those previous levels to release the hormones that produce those feelings of happiness and relaxation, like I discussed. As a result of the alteration in the reward pathway, individuals who become reliant on opioids will begin to experience horrible withdrawal symptoms once the opioids are out of their body. These symptoms include fever, headache, nausea, and chills, and this only reinforces their need to re-obtain that substance and misuse it. This brings me to my second point. Utilizing therapeutic communication skills can help convince someone struggling with addiction to seek help. Communicating with a person struggling with addiction can seem overwhelming and uncomfortable, but oftentimes those conversations become the catalyst for that person pursuing recovery. The Mayo Clinic outlines a thorough resource guide on how to approach these conversations and how to plan a successful intervention for your loved one. Some of the tips that Mayo Clinic includes are emphasizing love, support, and concern over judgment, and also bringing in a healthcare professional in order to make the intervention more successful. Some practical skills that should be utilized when talking to a person struggling with addiction include patience, active listening to express engagement, therapeutic silence to allow them to process, and open-ended questions to further the conversation and promote reflection. This brings me to my third point. When the worst case scenario becomes a reality, it is essential to be equipped with basic life-saving skills. Being CPR certified and carrying naloxone are the best means of care in an overdose. It is essential to be prepared in the case of an emergency, to prevent panic and fear, which may hinder the chances of survival in an individual experiencing an overdose. Basic life support, or CPR, is the training in which you receive to administer chest compressions and respirations to someone who is without a pulse or without breathing. A lethal side effect of opioid overdose is cardiac or respiratory arrest. This happens when a person's heart or lungs completely cease functioning. CPR is the manual intercession by a second person to pump the heart and oxygenate the lungs. Additionally, many hospitals provide CPR courses to community members several times a year, in which you're able to be certified in these skills. The American Red Cross offers a 45-minute online course, First Aid for Opioid Overdose, in which they provide a brief explanation of identifying and treating an opioid overdose before EMS is able to arrive. According to the CDC, naloxone, or Narcan, is a non-addictive, life-saving drug that can reverse the effects of an opioid overdose when administered in time. Naloxone competes for the receptor sites that opioids compete for and use to bind. Naloxone can reverse the respiratory depression and cardiac arrest if administered early enough to the opioid being consumed by the person. Naloxone can be acquired by non-medical personnel, and it can be found at a pharmacy or through local community-based organizations. This brings me to my conclusion. Opioid addiction is a grim reality that affects millions of Americans and will continue to if we do not intervene. However, you can choose today to be empowered by God's love and compassion to reciprocate that to those around you through early addiction identification, the utilization of therapeutic communication, and becoming CPR certified and acquiring naloxone. I encourage you to evaluate where you feel uncomfortable or more hesitant in regards to approaching the issue of opioid addiction and lean into finding confidence to confront those fears. You can be the difference in somebody's life. Thank you.